Obviously, the patient needs an assessment, and there may be multiple issues that are going on. So again, if it's an acute injury, rest, ice, compression, elevation, and then we often will give a short course of an anti-inflammatory, and then followed with that, we will then send them for rehabilitation, often with a physiotherapist, and depending on what sort of issues, we will then focus the rehabilitation on correcting the problem that's been causing the pain. So in general, most patients will improve. Some of them, they may need a knee guard or a brace as well, and yeah, that's usually enough for most patients. Other options for certain ligament or muscle tears, there are injections. One is called platelet-rich plasma, or commonly known as PRP injections, whereby we will draw blood from the patient, we spin it, and we take the serum and the platelets, which hold the concentrated growth factors. And then we will inject it into the injured tendon or the ligament. And that is now a FDA and HSA approved method of accelerating healing of those structures. And I've done that in a lot of sprinters, actually, in a lot of runners, in terms of rehabilitation. For damage to the cartilage, there are injections, sort of like a oil injection into the knee that will decrease the friction. And in laboratory testing that have shown to improve the cartilage cells with these injections. So for patients with mild to moderate cartilage damage or arthritis, we will recommend these injections, and that can help anywhere up to from 6 months to 2 years. And then, of course, there's arthroscopic surgery, which is keyhole surgery, which we can do for ligament reconstructions or repairs of the meniscus. And then lastly, for those that have severe established arthritis, there is knee replacement surgery. And again, now we have that as computer-guided or robotic knee surgery as well, which is the latest, which essentially allows you to optimize the alignment of the implant to allow maximal durability of the implant, essentially.